With many children now involved in virtual or hybrid learning, will eye problems be on the rise? And what could you as a parent do to protect your children's eyes from all those screens? Dr. Mark Rallo is a pediatric optometrist at St. Louis Children's Hospital, and he joins us now to talk about this whole idea of virtual learning eye care. Why? Because 2020. How are you, doctor? It's good to see you.
I'm doing great, Matt. Good to see you again.
So let's start with the simple question. Can staring at a screen for virtual school, for example, hurt a child's eyes over time?
The COVID pandemic has obviously impacted how kids are learning nowadays. There's usually either kids that are either home full-time virtual learning or maybe some hybrid. And so kids are obviously exposed to computer work much more so than normal. Can computer use affect the eyes? Fortunately, there's no long-term or permanent damage that can occur with the eyes for these young children, but certainly there are issues that can occur. It can range from dry eyes, eye strain, that type of thing. And so there are a few things that parents can take into consideration when trying to determine what they can do. And trust me, I'm getting a lot of questions from parents nowadays wondering, okay, is this harmful to the eyes? And if so, what can we do?
Sure, I bet. So how do you recommend they move forward if they do feel like they're seeing some problems or some strain?
Sure. So there are really maybe 3 or 4 things that I look for and recommend. Number one is the issue of glare. And so I do recommend that where they are set up in terms of the computer placement, that the room is certainly not too dark or is affected by sunlight because that can cause glare, which can contribute to eye strain. The other thing is just fatigue. And so one of the things that we recommend is visual breaks. And this is really important when you're on a computer, several hours a day. And so one of the rules that we go by is the 20-20-20 rule. And what this is basically, for every 20 minutes that a child is on the computer, they should take at least 20 seconds to look at something at about 20 feet distance. And so it's just a brief visual break, just gives the eyes a chance to sort of recuperate from the effect of staring at the computer, so to speak. My personal recommendation with that, I even recommend for every 30 minutes on the computer to take a 3 to 5 minute break, just something to break that fixation on the near task that they're involved with. So the other things that we're concerned about and that we hear a lot about is blue light emission. And I have had, again, several questions regarding this. To be honest with you, there's really no definitive evidence, clinical evidence, that there is harmful blue light emission from the computer screens. It's very mild. Now, certainly sunlight produces much, much more, and that's a different story. But the concern with blue light in general is it can cause eye disease such as macular degeneration. And the other thing that we also are concerned about, it could affect sleep cycles and that type of thing. And so a lot of parents ask me about the use of these blue filtering lenses. And again, because the clinical evidence isn't definitive, we certainly aren't promoting the use of these specific lenses. But if a parent is comfortable and wants to do that, it certainly is not harmful to try something like that.
Okay, Dr. Rallo, thank you so much for your time. When in doubt, do what his patients do. Ask a professional. Ask someone who does this every day. We appreciate your input, doctor. Take care.
All right, thank you.
Dr. Rallo.